It's my honor to be able to introduce you to Farrell Turner, who is the CEO of Physicians Care of Clark. He is also the president of the Alabama Rural Health Association. And as a reminder for everyone on today's call, the focus of the Match Coalition, our acronym is Internal Applications of Technology for Community Health. And our focus is on digital technology and the role that digital technology plays. And we're very grateful to have Farrell with us today because of his role. He has a unique position of being able to see all of the dynamics and the needs and support the various stakeholders, diverse group of stakeholders throughout the state of Alabama. And certainly digital technology has been a very significant addition to providing for better health throughout the state of Alabama. And so that is going to be our focus for today's discussion. We're going to learn a little bit about himself and his facilities. The Physicians Care of Clark is unique in that it is very similar to a federally health qualified center, which means it does a significant amount of work to be able to help those throughout the areas and the communities that it serves, both those who qualify for Medicaid as well as those who are indigenous, who may not have access to any health care at all. But versus hearing it from me, let's hear it straight from Farrell.
Be glad to do that. And so just to expand just real briefly about our organization, we are a federally qualified health center. A look-alike just means that we don't get grant funding. And so we're hopeful that maybe at some point in the future we'll be able to get that. But for right now, we don't. But it still has really opened up a lot of opportunities for our patients. We are located in Southwest Alabama, which is a very poor part of the state. And as you probably know, our state is also pretty low on health outcomes, as well as socioeconomically in the whole country. So we serve about 12,500 patients, and we'll probably do about 40,000 visits this year across 5 locations. And so it has really been a good thing for us, and I think a good thing for our area of the state. So our organization does use electronic health records, and maybe I'll talk a little bit later on a little bit about our use of technology. I think we wanted to talk a little bit about maternal health in the state of Alabama. And so as you know, and I guess we're one of the states that have some pretty low metrics in that area. We are ranked, at least from the data that I was able to find, 45th in the United States for infant mortality. And so even within that, we've got some issues with those numbers not being equal across all the races that we deal with. For example, Black deliveries in our state was over 50% higher than the overall population itself on infant mortality. And so that's not very good. We also look at low birth weight. We're higher there. Neonatal mortality, we're higher. All those things are sort of a negative outlook for our state. We are, I guess, to talk about our state specifically, we have about 5 million people in our state. About 2 million of those are rural. And so you will hear that with my relationship with the Alabama Rural Health Association, and also with our FQHC being located in rural areas, it has a bit more of a rural focus than anything else that's out there. But we do have a number of issues in the rural areas, and people having access to care, especially those persons who may be pregnant and need access to care when they deliver. In our state, 50% of all births are financed by Medicaid, and that's according to the Kaiser Family Foundation. um, of the overall female population in our state, 29% who are childbearing age are either uninsured or covered by Medicaid. So, those are both metrics that are not very good for good outcomes. The United Alabama, and you'll hear me also reference to county health rankings and roadmaps. I'm on the Alabama State Steering Committee for that, and hopefully you're familiar with that, but it has its own website, and it is located at the Wisconsin Institute for Population Health, and it's Robert Wood Johnson funded. And there's just tons of really good information out there from those folks. And so really in just about every metric that the county health rankings has out there, that Alabama is below the United States average. And those include things such as childhood poverty and also children in single parent households. So those are, not very good metrics either. Alabama overall has a low fertility rate. And really what that means is that we are not really producing enough through the birth rate to replenish the population. And so that's, I think, common in the United States in many parts of the US, but in our state in particular, we're below that. Within our population, we are, I think I may have said about 40% rural, and everybody else, the other 60% are in urban areas. It also just seems, at least from my observation, that many of the newer industries and announcements for jobs tend to be in the more urban areas rather than rural areas. And so that makes it even more difficult for people who may be challenged in terms of, jobs and health insurance, especially. So, Fran, I don't know if you've got any questions about the maternal outlook in our state, but that was sort of my comments on that.
That's beautiful, Farrell. And I think the first thing is that for many of us, right, let's just be honest, unless we are from the area, from the state or neighboring state, perhaps, many folks are not very familiar with the geography, right, of Alabama. We know Birmingham, many folks know Birmingham, folks know Huntsville, particularly if you're in the South, right? Huntsville, Alabama is known by many, and I think NASA is out there in Huntsville, isn't that right? Those are places where people are familiar. But when you say Clark as an example, we hadn't a clue. So first off, where is Clark? What does that look like? I know you've got some Gulf Coast region as well that many folks don't even realize, right? There's just so much we don't know about what the state itself looks like, and that maybe that might help us get an appreciation for what the infrastructure is like within the state and how that impacts much of the adoption of technology.
So Alabama is one of these north-south states in that it's we do go all the way up into the Appalachian Mountains. And in fact, my home where I'm located today is a little bit up in the Appalachians. And so we have a little bit of that culture. And that does go through like the north to north central or east central parts of the state. Then as you go further south, way back, it was certainly a very farm-based economy and still is in many ways, the south part of the state. As well as the north part, because you've got the Tennessee River that comes through the north part of the state. And there's a lot of agriculture up that way. Where our clinics are located is much further down south, close to Mobile. And so we're about an hour and a half north of Mobile. Mobile is a major shipping area. And so there are, there's a lot of, I guess it would be freight and other shipping type activities down that way. It also, we do have an oil and gas industry, especially offshore, but there are parts in the southwest part of the state that have some of that industry there as well. And so, fishing is a big thing. We do have some beaches. And so a lot of times you may not think about that quite so much because, it doesn't really appear on the map to be very much related to the Gulf of Mexico, but it's there. We also are blessed with a lot of rivers. And so I know they talk about that in some cases, the like the wildlife and I guess plants and that sort of thing flourish up through the rivers. And I have seen it where at least parts of our state may be among some of the most diverse in the whole country from that perspective. So it's a very interesting state. Yes, we love our football, but there's a lot of other activities. Birmingham is sort of in the north central part of the state. Huntsville is north and east. Huntsville, I think, has now, with the most recent census that we've got out there, there's been a little bit of shuffling because Huntsville has grown so much that it stepped up in one of our more populated counties. Traditionally, you would think of Birmingham, Montgomery, and Mobile as the three busiest or most populated areas, but now Huntsville has kind of stepped up. And I think there's been so many announcements of different activities coming into Huntsville that it will probably continue to grow. And I know healthcare is a big thing up there. The hospitals in that part of the state pretty much cover the entire north part of the state. And so they've been pretty active as well with rural health. And they operate many of the rural hospitals located up in that area through either management agreements or something like that. The hospitals in Birmingham, a lot of people may have heard of UAB. I think they nationally they are pretty well known for that. So it's pretty major there. Mobile has some large hospitals, not to be left out there, in Montgomery as well. So we do have some strong hospital systems in the state, but many of our rural hospitals have actually closed. And so we have 67 counties in the state. Of those, 54 are rural. And so we think about hospitals as being very important for overall health care, and that would include the maternal health as well. And so back in 1980, 45 of the 54 rural hospitals provided obstetric care. By 2019, those 45 counties have dropped to only 16. So now there are only 16 rural counties in which they provide obstetric care. And so that's a real problem. We also experience a shortage of physicians. We have been fortunate in that, I guess over the last 10 years or so, we've had two brand new DO programs, osteopathic medical schools that have been created. But unfortunately, the slots for physician residents have not kept up with that. And so that creates, a problem in that there's a shortage of physicians, but the OB side is also a big issue. And so, it's a lot more difficult in many cases for physicians to really make a living in a rural area. And so that makes it a little bit difficult. You almost have to have somebody who maybe was born and raised in a rural area for them to want to come back to a rural area and practice. Some other things that we deal with, the midwives are not licensed in Alabama, so we really don't have that as a fallback on the OB side. Poverty is a real issue. People may have to travel great distances in order to reach any care, much less obstetric care. And so, there are cost issues there, there are distance issues there. And so that's a real problem. We also think about, just in our state, the overall health of the population is not very good. And so we think about there are extremely high levels of obesity, hypertension, diabetes, that sort of thing. And so people don't eat very healthy. And so the byproducts of that, may be some of these things that are not very healthy for the individuals. And if you got an individual that is already not very healthy, and then when they become pregnant, that just has the potential to complicate their care and maybe even that of the baby once it arrives.
So Farrell, you mentioned prior to getting onto this call, some of the dynamics that are occurring in terms of obstetric deserts. Can you share with us a little bit about what that looks like and what type of conversations are the is the Rural Health Association having at a state level? And what kind of programs do we see coming in place, and how is technology being utilized to try to address some of those challenges?
Sure. Well, and so, and one of the things, and this was a project on my consulting side I did for the state of Georgia, where I used a program named Maptitude that does geolocating. And so we were able over there to do a map where basically we had a dot for every physician in the state of Georgia. And so we were able to also identify within that those who were OB or family practice obstetrics. And so it was very easy when we did that, use that software there. We've not done that project in the state of Alabama, but a story I will share with you is that our most recent past president in the association, Dr. Peter Strogoff, is a pediatrician up in Fort Payne, which is up in the northeast part of the state. And he's really been concerned here lately that the counties up in that whole area up in there, and so this is an area that's east of Huntsville and back toward the Georgia line, not too far maybe from Chattanooga, Tennessee, that at one time up until recently, they had 10 obstetricians up there in that area. And now due to retirements, they are now down to just 2 to serve that entire area. And so, he's just very concerned. And of course, with him being a pediatrician, his concern more is, being able to deal with the babies when they come. And with not having a lot of obstetric care, that could certainly have some adverse outcomes for his patients, and maybe even the supply of patients coming into him, because it's like, they very well, once they may go to a hospital, say in some place like Huntsville, or because they now may have to travel that far for OB care. A lot of times those relationships get built upon delivery. And once that happens, then the local care may suffer from that, just because people now, well, so-and-so up in Huntsville delivered my baby. I'm going to go back to that pediatrician for my baby's care. And so people like Dr. Strogoff may see their practices diminish. And, it very well might be that he may end up having to go somewhere else. Now, he and I haven't talked about that. I'm just kind of speculating on it, but it does create sort of an issue for them to try to deal with that. But technology wise, some of the things that have been very helpful, certainly the expansion of telehealth has been good. One of the issues, though, that we really deal with in much of the South, especially in Alabama, is the lack of broadband. And so, you've got to have broadband in order to be able to do very good telehealth. And so it has gotten better. There has been, I think, a lot of funding that has been announced. But quite frankly, it takes a while. And I just don't know that a lot of the broadband coverage has actually gotten implemented out. We were talking about a little bit before the call that I know where I live, up until about 6 months ago, I don't know that I'd be able to really even talk to you all as well as I am today, because up until that time, my broadband was just barely existent. And fortunately, we were able to get a fixed wireless service that is really quite good. And so I'm lucky with that. But I think many parts of our state would not have that capability. And so that could be a bit of an issue out there. So, technology is important. Telehealth can certainly help. I know in our clinics, we've begun a school-based telehealth program that's just getting started. And so we really are excited about that, and really feel like that we're going to be able to impact the lives of a lot of our patients and the people in our area through that program. And a lot of this technology includes, many of those devices or attachments to it, to where really, I hate to say a full physical examination can occur, but it's pretty doggone close to it, because it's got a number of different features that allows for a much more thorough examination than what used to happen. But some of the other things that we are in our clinics, in addition to telehealth, and we're through the telehealth platform, we'll be doing some of this. And I think a lot of this does relate to the maternal population, one of the things we're doing is on the behavioral health side, because that certainly is a component of overall health. And so it's ESPERT, which basically is a short-term brief intervention and referral for treatment. And so basically that gets in and does it is a questionnaire to help identify either depression or potential self-harm. It also identifies the use of drugs, both legal and illegal, tobacco, that sort of thing. And so that can certainly have an impact. If you can identify patients out there maybe that have got some issues along those lines, that can be hopefully addressed. And, if they are pregnant, especially be able to impact their overall health so that can help once the baby comes. One of the other things that we've just started, and we use a kiosk system in our clinics. And I've not really done research to verify this, but it just for our own perspective seems like that patients are a lot more willing to respond to maybe sensitive questions when they're dealing with their computer. And so the system we've got, they actually can use their own cell phone, or if not, we've got like an iPad type device that they can use for answering these types of questions. But we're now actually also getting into the social determinants of health. And so I know our social work team has already identified local resources. And so if we do have people who have issues either with transportation, with housing, with food insecurity, those sorts of things, that we can now identify those patients and can hopefully be able to tie them with some resources in their own neighborhood or their own location to where they can overcome some of those things. We also have, as an FQHC, we have a sliding fee scale. So if someone either is uninsured or if they're not fully insured, that we can help identify that, and we can then provide care to them on a either free or a reduced charge basis. And so I think, technology from that standpoint helps. There are a couple of other things that we've done recently, I think, that also has taken a while to get going, but we have tied in our software. It's now linked with the state of Alabama vaccine registry. And so, that's not only for COVID, but also it's very important, for young children, especially, to make sure that they're getting their childhood vaccinations, and we're making people aware of that's available. And so that once we register them and administer those vaccines, that gets reported to the state automatically without us having to get too involved with it. We also have our health record system to where it is linked in with the Alabama Health Information Exchange. And so we think that there are a lot of benefits that are going to come out of that to where we can see what other care that the patients are receiving and then better coordinate that. We also, through our program, we have a 340B drug program, and that's something else that through technology and it's just a real exciting aspect there to where we can provide some medications at a very reduced cost, either directly through our organization or through the local pharmacies that we have relationships with. So technology is a big part of that. And it's just so interesting to me to see how we've been able to use the systems that we've got and expand those to hopefully improve the health outcomes of the patients.
Farrell, I love it. Absolutely very insightful information. Very good to see that not only has telehealth been something that's adopted, and that I presume you're continuing to work directly with the telco companies and that are out there to continue to improve access to broadband, but that you're also leveraging technologies within a variety of the care facilities, utilizing kiosks and providing access to digital based tools and technologies so that you're able to more efficiently address social determinants of maternal health. I always like to give those who have attended the opportunity to ask questions. Who would like to ask the first question? Any takers?
I got a question for Farrell. Farrell, you mentioned midwives, and they're not certified or they're not qualified in the state of Alabama. Could you expand on that a little bit?
Well, so they're not licensed, and so what that means is they're not they are not allowed to practice independently. I know a lot of states have, not only for nurse midwives, but also for nurse practitioners and physician assistants. In some cases, they're able to practice independently without having a collaborating physician. And but the way that our state handles it is that, like, the nurse practitioners and PAs go through that licensing process. And part of that is that they do have to have a collaboration relationship with a physician. And so at this point, the midwives are also tied to working under a physician. And so it's just not quite as, they're not allowed to practice at the same level scope wise as maybe other states.
Right. So the fact is, Alabama does not allow them to be licensed for that reason, that they need them to practice under a physician or participate under the care or on look of a physician. Is that correct?
Right. I do think that legislatively and regulation wise, things are beginning to look a little better. For example, up until about a year ago, physicians were only allowed to collaborate with up to 4 of these mid-level providers, and that just recently got increased to 9. And so that is a very good event there. And I know that I think he's the state Senate chair of the committee that deals with health, has been really aggressive in trying to open up to allow these providers work more to their full scope of capability. So hopefully that will continue.
Yeah. Thank you, sir.
Great question and very interesting insight on how that's going. Makes me curious on the other end, a lower skill healthcare professional group is doulas. And we're seeing a lot of that activity on a national front. What is that looking like for the state of Alabama, and how is the Rural Health Association supporting the efforts of doulas as well as breastfeeding or lactation consultant services? How is the Rural Health Association engaging in that?
Well, and probably not so much. And so, with our state working the way that it does, sometimes we are a little bit slow to open up scope of services. I think that we do have some of those folks that work. I know on the lactation side that we do have people that in that specialty, but it tends to be in a much more restrictive environment than maybe what we would like. And so, what we try to do in our state is to certainly prod, the expansion to the full scope of practice. But we do have, part of what we have to deal with is that we do have some who are our members, and some of those may be physicians or others that, it may not be quite as open to that expansion. And so we certainly try to work within the environment that we're provided, and, we can prod. I know, like, through our National Rural Health Association, we talk a lot about advocacy. And so we certainly advocate to try to get both groups talking, because it's like, I know it, even in one of our meetings a couple of years ago, that, some of these discussions can get kind of heated. And the biggest part of it is to get both sides talking and communicating. And I think once you do that, then you can see that, maybe their ways of thinking are not that far apart. So it is a challenge in our state, but it's something that we certainly try to encourage communication. And I think whatever we can do to expand things in a good quality way is certainly good for the patients, given our issues that we deal with in the state.
Well, Farrell, thank you so much for your time, and thank you to everyone today. We greatly appreciate you. Just in closing remark, historically, I have found the rural health associations throughout every state, as well as the National Rural Health Association, as having an open door sort of policy and willing to work with folks from all ends. I would love to ask that we would get the same from Alabama Rural Health Association. Tell us how we can get involved with you. Folks would love to know. Well,
and I think certainly, we started this communication with you guys. And so I think it certainly would be good. I know I signed up. I think I registered. So hopefully I was successful in being a member, but if not, I certainly would want to do that. I also know that Ron Kelly, our administrator, is on the call today. And so we put out a weekly newsletter. We do also, through our advocacy efforts, work with our state and federal legislative elected officials. And so, there very well may be a lot of issues that are important to you guys that we need to be aware of, and do what we can through our newsletters and other advocacy efforts to try to help. I did not mention early on, but State of Alabama Rural Health Association is probably in the top 10 of the whole country. We're now over 1,000 members. And so that is a strong voice, and a lot of different voices out there that I think can help a lot of situations out there.
Thank you. As you know, the archive of this program will be available. So please be on the lookout for that. All right. Thank you, everybody. Take care. Bye-bye.